ادعمونا بلايك للفيديو واشتراك بالقناة، فهذا يدعمنا كثيرا.
Good morning, students. I hope you are there. I'll be talking today on dental implants. This will be the first part in dental implants. I would like to divide the topic today under the following contents. Number one is a brief introduction and historical background, followed by biological considerations, classification, parts of an implant, clinical assessment of what you call test, treatment planning, indications, contraindications, advantages and disadvantages. Now, what do you understand by the term implant? An implant, the one which is one of the methods by which we can replace the missing tooth or teeth. Like what you see on the slide now is an edentulous area which can be replaced by different methods, that is fixed and removable. Removable, you know, those are removable partial dentures of different types, simple acrylic forms or the chrome cobalt type. Under the fixed ones, you have fixed processes, what we call it as bridge work. Now the disadvantages of a bridge work is we have to cut the neighboring two teeth which are normal. So to remove that disadvantage, the new method in fixed, which has come in the recent times, that is about after 1975 onwards, is implants.
ادعمونا بلايك للفيديو واشتراك بالقناة، فهذا يدعمنا كثيرا.
Now we'll just try to know about what are dental implants. If you go by the definition, it is a biocompatible alloplastic material or device that is surgically placed into the orofacial tissue and used for anchorage, functional, therapeutic, and or aesthetic purpose. In simple words, it is an artificial tooth put into the jaw to hold a replacement tooth or bridge. The second important terminology, which is very important, is osseointegration. It is nothing but a direct contact of the living bone with the surface of an implant at the light microscopic level of magnification. This was given by Brainmark in 1951. So in general, if you think about, implantology is a science dealing with implants. The next important content So initially, any form of tissue response which we see when the implant comes in contact with the bone is the inflammatory reaction, which is followed by bone resorption, and the growth factors which are surrounded there are released. Followed by that, there will be chemotaxis of the osteoprogenitor cells, or what you call it as the stem cells, which get differentiated into osteoblasts. Followed by that, there will be bone tissue changes, that is damage and debris of the osteotomy site, cleared by the osteoclast. I repeat again, the inflammatory reaction followed by bone resorption, growth factor release, chemotaxis of the osteoprogenitor cells, then followed by differentiation into the osteoblasts, then followed by bone tissue damage and debris at the osteotomy site, cleared by the osteoclast. So basically what happens is the factors which affect osseointegration is micromobility of the implants above 150 micrometers. The second point is excessive heat production during osteotomy, that is above 47 degrees Celsius. The third is inadequate vascular supply, and the fourth is insufficient oxygen tension. Now these factors are very important I repeat again, these factors are very important to attain good osseointegration. I repeat again, there has to be good vascular supply for good healing. There should be sufficient oxygen tension in the region. If there is less oxygen supply, one of the steps which I had earlier mentioned during osteotomy is the differentiation of the stem cells into fibroblast will happen. And when there is overheating or crushing of the bone, scar tissue and sequestration can occur, which can lead to failure of the implant. Followed by this, the steps involved in the healing of the implant with the bone is the woven bone quickly forms between the implant and the bone, fast growing in all the directions, and there is random orientation of the collagen fibrils. There is high cellular movement and limited mineralization. So if you keep the drilling in a slow and sustained manner, depending on the type of bone you drill and the type of system, implant system you're using. So I hope you understand the term osteotomy. I must have repeated these terms many times. It is nothing but the site which you create with the implant drills, where the implant will be placed in the bone. That's called as the osteotomy site. Going to the next slide. You can see how the process of healing occurs. This will be dealt in detail in part 2 of the same chapter, that is dental implants. I'll just give you a rundown on how the process occurs. First, the woven bone is replaced by the lamellar bone. Then organized parallel layers of dense mineralization occurs. That's a very slow process. It takes about 18 months for a steady state. But clinically, approximately, like fracture of a bone, it takes about 4 to 6 weeks to heal. The same way in implants, after the initial placement of the first component of the implant, the loading can be done only after 2 to 3 months. That again depends whether you're placing an implant in the mandibular jaw or the maxillary jaw. Mandibular, we may have to wait for less time compared to the maxilla. We go on to the next slide now. So after describing the hard tissue interface, what happens in the soft tissue side? So if you see the diagram, there's a soft tissue which will be surrounding the implant. We call it as a peri-implant soft tissue, which is very similar in appearance and structure to the periodontal soft tissue. So you see the diagram, you have a sulcus, you have a long junctional epithelium, and a zone of connective tissue. The first is the epithelium, which lines the sulcus and the apical portion and the long junctional epithelium. The epithelium is about 1.5 to 2 mm above the bone margin. Now if you see the diagrams, one is of the natural tooth and the gingiva, and the second one is the B is a soft tissue or a peri-implant soft tissue along with the dental implant. This is one thing you should always remember. You'll be asked in your vivas, what's the difference between a natural tooth and a dental implant? The first difference is, in a natural tooth, you have a structure called as periodontal ligament. Whereas in an implant, there is no periodontal ligament because the implant gets osseointegrated with the bone directly. So in a natural way, it is very close to two pieces coming together, like what happens in healing of fracture of the bone. The second is the tooth has an ability to move because of the periodontal ligament fibers, which acts as a cushion, whereas an implant cannot migrate because it's fixed with the alveolar bone. The proprioception, which is present in the normal natural tooth, is very much reduced in the dental implant. Normal tooth is connected with the bone with the periodontal ligament fibers, whereas in dental implants, it's osseointegrated. The fibers in natural tooth runs perpendicular, whereas the fibers in a dental implant runs in a parallel fashion. I repeat again, these are the 5 basic differences between a tooth and a dental implant. The most important one is there is no PDL or periodontal ligament fibers in implants. So automatically your proprioception, your movement of the tooth is all lost, which is one of the basic functions of the periodontal ligament fibers. That is one of the main reasons that you cannot fix or implant and a natural tooth where you're going to make a bridge. because one will be moving and one is fixed. This is one thing you should always remember. Followed by this, we go into the classification based on the implant design. I'll name a few. Number one is endosteal implants, subperiosteal implants, transosteal implants, and intramucosal implants. The endosteal implants can be further divided into the ramus frame, the root form, and blade form. The next classification is based on the surface of the implant, which can be divided into smooth surface, the machined one, the textured one, and the coated surfaces. The next classification is based on the implant material used. That is metallic, ceramic or ceramic coated, the polymer, and the carbon compound. Now, before we go into the indication, contraindication of implants, I'll just give you a brief rundown on the parts of the implants. So if you see the diagram there, there are three basic components. That is the implant, which is fixed into the bone. Over and above that, that's an abutment. And above that, the crown comes in. These are the basic three components you should remember. The similar smaller components which are there in detail is as follows. Now, if you see the implant as such, as marked there in the diagram, the coronal part is called as a crest module. The center portion is the body, and the third part, what you call it as the apex. Now, once the implant is inserted into the bone, there is an opening in the center of the implant. So immediately after placing of the implant, the soft tissue has to be covered over that and sutured. If you do it like that, what happens is the soft tissue can grow into the open area of the implant, which will come in the way of the healing process as well as fixing of the abutment. So usually what we do is, after the implant is placed, is the term called as cover screw. The cover screw is placed and the soft tissue is sutured over that. and it's left in the same place for minimum 2 to 3 weeks for it to heal. The sutures are removed. And the cover screw is exposed in different methods, which will be dealt in the second part of the same chapter. And after removing the cover screw, the healing abutment is placed. So you get a good aesthetic emergence of the dental implant. That's called as healing abutment. So again, the same thing is there on the slide which I was explaining you. The cover screw will flush with the surface of the implant completely covered by the oral mucosa. The implant abutment is the part that lies between the implant and the crown, as you saw in the last diagram. The healing abutment is a temporary abutment that is placed after the implant is being placed after second surgery and removed before the placement of the permanent restoration. Now we go on with the treatment planning. So when you do the treatment planning, the most important thing is clinical assessment, which includes the indications and the contraindications, followed by the basic investigations, so that we are ready for the placement of the implants. So first we'll discuss in detail about clinical assessment. We'll have to take a comprehensive history of patient's current health, the chief concern, education of the patient, and about the treatment option which we have to explain to the patient. So you have to give all the three options which is there. So that is a removable denture or the removable partial denture, bridge work, or dental implants. Medical history is very important because there are medical conditions which may be contraindicated. It may be an absolute or a relative contraindication based on which we may proceed with the implant procedure. Dental history, the previous experience with surgery, the compliance of the previous treatment, and the current oral hygiene practices, which are very important because if the patient is not indicated medically or the patient is not maintaining good oral hygiene, then you'll have to educate and motivate the patient to a level where the patient is ready for the implant procedure. The intraoral examination, we have to assess the hard tissue and the soft tissue. Check for any pathological conditions in and around. The oral cavity should be free of all infection. Since you know that implant is a surgical procedure, so it has to be done after the etiotrophic phase. That means all the other etiologies in the oral cavity should be removed. Whether it's a primary etiological agent or a secondary factor. Basically, it should be free of any inflammatory or infective situation. Then you have to check the mesodistal and the buccolingual measurements of the edentulous site. There are different methods for that. To check how many millimeters of width mesodistal or buccolingual measurement is available. The height of the bone will be calculated by using the other investigations, that is radiographs. Now how much space is required for placement of one or more implants? That's a question you would like to ask me, and this is exactly what you have to plan. You see in the diagram, the space between a natural tooth and implant should be minimum 1.5 mm. The distance between two implants should be minimum 3 mm. And at least 1 mm bone should be covering in and around the implant. That means 1 mm on the buccal and 1 mm on the linguropalatal region. This is a minimum requirement. Based on that, the implant size is selected to be placed into the edentulous area. So I repeat again, 1.5 millimeters distance between the implant and the natural tooth. Between two implants, 3 millimeters. A minimum of 1 mm on the buccal, palatal or lingual aspect. Basic requirements. Indications. First is edentulous patients benefit the most. You have different types of processes, that is implant assisted removal processes, which is denture-like without any flange extensions, or flange extension which supports the lips. They have implant supported implant processes, fixed processes, that is direct emergence from the gingival tissue, similar like natural teeth with minimum lip support. The prosthetic part will be dealt in detail when you hear the same topic from the prosthetic department. So they'll be dealing with the prosthetic details or prosthetic aspects of dental implant in detail. The second is partially edentulous patients with a single tooth or multiple. Single tooth or bridge processes. Especially in the posterior teeth, a distal extension is missing. Then implants becomes a perfect indication. Diagrammatic representation, clinically before and after, placement of the cover screw, and the final with the processes, what you see in the IOP X-ray. The third is the aesthetic consideration. You require good bone volume, bone height, tissue thickness, good biological width, satisfactory aesthetic results when there is healthy periodontal tissue surrounding the implant, especially in the aesthetic zone, what you can see in the photographs. Coming to the contraindications, as I said, you have relative and absolute constant. The relative ones like diabetes mellitus, which we all know that is impaired wound healing, and which can lead to infections. The second is bone metabolic diseases, which impairs the patient's ability to achieve and maintain implant osseointegration. When I say bone metabolic disease like osteoporosis, etc. Medications, steroid therapy, which suppresses the immune system and thus impairs wound healing. Then you have bisphosphonate related osteonecrosis of the jaw, which is called as bronch. So these are the contraindications. Then you have HIV or AIDS, seriously impaired immune system. Those are not good candidates. Patients who have undergone radiation therapy, psychological and mental conditions, are also contraindications. Habits or behavioral pattern like smoking is one of the relative contraindication. Parafunctional habits like grinding, bruxism can lead to loss of integration and implant fracture. Substance abuse like alcohol, treatment refused until addictions. Now, these are some of the contraindications you can remember. So in a tabular form, easy to remember the conditions which are absolute contraindication or relative. Diabetes is relative, bone metabolic disease is relative, mental instability, mentally impaired, absolute contraindications. AIDS and immunosuppressive medications, relative. Substance and drug abuse, absolute. Smoking, tobacco use is relative. parafunctional habit is related. So if you remember that absolute contraindication is mentally unstable, impaired, and drug abuse. These are absolute contraindication. The rest of the things like diabetes under control or any bone metabolic disease under control, parafunctional habits can be controlled and treated, followed by the placement of the dental implants. What are the basic investigations you have to go for? In general, you should remember diagnostic study models for assessment of the potential size, assess the available space, malocclusion, intraocclusal space, it helps in preparing the stents. Then you have radiographic examination, that is periapical, panoramic projections, or CBVI, CBCT. There are different methods which are required in the planning of the dental implants. The one more thing which you have to assess is the quantity and the quality, location of the alveolar bone, the vital structures, floor of the nasal cavity, maxillary sinus, mandibular canal, the mental foramen. With the CBVI will help you getting all the details of that. And this will be dealt in detail in part 2 of dental implants. Going on to the advantages and disadvantages. Advantages: your better appearance, comfort, and speech. As we all know, the basic functions of the teeth is for mastication, aesthetics and cosmetics, and phonetics. So if you wear a partial denture, which is removable, you'll always have problem in cosmetics as well as speech and mastication. And if you go for bridge work, you have to cut the neighboring good natural tooth which are normal. So presently, implant is the in thing which is used, but you should always remember that you have to select the case. Because it's a bigger procedure, more expensive procedure. So the advantages, I repeat: better appearance, comfort, speech, better masticatory efficacy, improved psychological health, and most important, the adjacent teeth are not touched. Disadvantages in today's situation is the cost, some surgical complications, and operator skills. I hope you understood the lecture on dental implants. Thank you very much. Have a good
ادعمونا
day.
بلايك للفيديو واشتراك بالقناة،
Stay
فهذا
home.
يدعمنا كثيرا.
Stay safe.